us to better confront future pandemics. And in fact, we hope to achieve an agreement that takes into consideration the interests of populations that were very much tested during the previous pandemic. Thank you.
Thank you. Hungary, you have the floor.
Dear Mr. President, Mr. Director General, dear colleagues, I am proud to stand on this stage as a compatriot of Katalin Karikó, who just received yesterday WHO's honorary Lifetime Achievement Award for the inevitable role she has played during the fight against the pandemic. The pandemic, which we almost forgot, although only 4 years have gone since that, but there's a new and even maybe more serious crisis which has blown out, namely the war in Ukraine, which has been causing tremendous geopolitical changes, among them very concerning ones, like the over-politicization of the international organizations, which we consider very dangerous, because the way we can give successful answers to major challenges and crises is the way that we base our reactions on professionalism, common sense, and rationality. So one of the major consequences which must be drawn from the pandemic is that the health of the people and the fight against pandemic must not be considered as an issue neither political nor of ideological nature. If Hungary had managed the pandemic on political or ideological basis, there would have been thousands and thousands of more casualties. But instead of that, we have taken advantage of the fantastic achievement of the scientists, independently from which geographic direction they were coming, either from the east or from the west. And based on that, we have performed the quickest and most successful vaccination campaign of the entire European Union. And Mr. President, if you allow me, I'd like to come to the European Union now, although it does not make everybody very happy in Europe, but Hungary is taking over the presidency of the European Union very soon, and we will have two strategic goals when it comes to healthcare. First, we have to acknowledge that the leading role of death in Europe is still the set of cardiovascular diseases. Therefore, we will prepare a common European cardiovascular strategy and action plan, in the framework of which we will argue in favor of establishing a common European platform for clinical trials to be coordinated, to put more emphasis on prevention and rehabilitation. And in the meantime, Mr. President, I'd like to draw your attention to the fact that the transplantation donation rate has dropped very rapidly by 25% after the pandemic. And in this regard, we Hungarians would like to argue in favor of a new European strategy for transplantations. Dear Mr. President, dear colleagues, dear Director General, thank you so much for your kind attention, and wish you all the best in your future endeavors to keep WHO as a super professional organization. Thank you.
Thank you, Hungary. Canada, you have the floor.
Merci, Monsieur le Président.
Thank you, Mr. President.
Ministers, distinguished guests, le thème de cette année nous tient à cœur.
The topic of this year is very important for us. Everyone, everywhere, should have the best level of care possible to promote well-being and prosperity.
It is clear that we must adopt multi-sectoral and whole-of-society approaches to address pressing and complex challenges like health impacts of climate change, non-communicable diseases, antimicrobial resistance, and health security threats. Canada welcomes GPW14's significant emphasis on prevention, health promotion, and action on the determinants of health, including the environment. We remain committed to closing the health equity gap globally and to coordinated action on the root causes of ill health. Together, we must improve health promotion efforts to reduce disease burden and foster mental and physical health and well-being. An integrated approach to essential service delivery requires the inclusion of nutrition, sexual and reproductive health and rights, and routine vaccination. This also means strengthening both external and domestic financing for health, which is why Canada is invested in the Lusaka agenda. We must also step up our efforts to address systemic and historical discrimination against Indigenous peoples within our health systems. Gender equality is foundational to a peaceful, prosperous, and sustainable future for all. Let us continue to fight racism, sexual and gender-based violence, and discrimination against marginalized groups, including 2S LGBTQI+ people, women, and girls. And let us renew our support for those on the front lines of care. We have a collective responsibility to ensure the protection of our healthcare workers and condemn the unacceptable attack on them and on health facilities. The many conflicts in the world, including Gaza and Ukraine, serve as stark reminders of the fragile nature of accessing critical health services. Canada urges all member states to support WHO's critical health emergencies work. A strong WHO must also be inclusive, reflecting the entire global community. This means supporting Taiwan's meaningful participation as an observer at the World Health Assembly. This week, we will collectively decide on next steps on both the pandemic agreement and on the IHR amendment and negotiations. Canada remains committed to continuing to work together to prevent and minimize the devastating consequences of future global health emergencies and pandemics, and to further advancing health equity for all. A meaningful pandemic agreement is consensus-based and one that member states can sign, ratify, and implement. Thank you very much.
Thank you. Uruguay, you have the floor, to be followed by Mexico.
Señor
Director General, Ministers, distinguished delegates, it's an honor to stand before you here at this World Health Assembly. Uruguay has a national integrated healthcare system, the objective of which is to provide quality, universal health coverage for its population. We implement public policies designed to improve primary health care, and we've taken a number of steps to improve the way in which we can resolve cases at the primary level. In 2023, we participated in an international conference commemorating Alma Ata +45 and Astana +5, sharing the guiding principles of our national system: universality, equality, and accessibility. And Uruguay was the host for the regional Alliance for Primary Healthcare in the Americas Forum. It's an important issue for Uruguay, as is intelligent health spending. With scarce economic resources, what we need to do is resolve issues like access to medicines and new technologies at affordable prices, and the judicialization of medicine, which generates so much cost for governments without necessarily being reflected in an improvement of universal and equitable health coverage. So the question is, should we spend more or better? Another important issue is to respond to issues like mental health, which has worsened since the COVID-19 pandemic. And Uruguay is investing strongly in an integral plan for the prevention and treatment of mental health problems and addictions. That has been enriched with exchanges with countries in the region and around the world. We must work together to prepare for future pandemics. COVID-19 led to a paradigm shift in the health situation, epidemiology, and forms of response with unprecedented consequences. And we believe that we need to work together to strengthen the global health architecture for preparedness and response, defining a common strategy, the HEPR, which was proposed at the 2022 WHO. For Uruguay, the negotiations taking place to amend the international health regulations and the negotiations for a new pandemic agreement are a historic opportunity for the international community, defining a legal framework to enable us to work together to prevent future pandemics. or otherwise guarantee the affordable access to medicines, inputs, technology and information in order to respond better to such pandemics. As an international community, we must continue to strengthen dialogue, exchange, the search for peace, ensuring the right to health for all. Thank you.
Thank you. Mexico, to be followed by Peru.
Estimado Director General,
WHO Director General, distinguished heads of delegation. The world seems to be forgetting the valuable lessons drawn from the COVID-19 pandemic. We can't expect a better future unless we deal with the deep underlying inequalities that divide us. Inequity undermines health, and in particular, timely, affordable access to medicines and health products. And these inequalities mean that we need to guarantee an effective response to health emergencies. And it's important to use those lessons learned from the process of COVAX. Mexico has participated actively in the negotiating processes underway, recognizing the need to reform global health architecture urgently. And we believe very strongly that international cooperation is vital to be better prepared for future emergencies without leaving the most vulnerable behind. So our position on the amendments to the IHR and the new legal instrument on pandemics is based on principles of solidarity and equity, identifying specific opportunities to improve global preparedness, such as strengthening regional and local production capacities, exceptions to patents in emergency situations, and the effective use of technical cooperation for better impact. The WHO has recognized the need to transform in order to respond globally to a world in constant change. And its role as the guiding body in health must also